Welcome to the Ordinary Doula Podcast with Angie Rozier, hosted by Birth Learning, where we help prepare folks for labor and birth with expertise coming from 20 years of experience in a busy doula practice, helping thousands of people prepare for labor, providing essential knowledge and tools for positive and empowering birth experiences.
Hello and welcome to the Ordinary Doula Podcast. My name is Angie Rozier. I'm your host, and today we have a special guest with us. I have with me today Royce Porter, and Royce is an occupational therapist who has a special focus in perinatal care. So I'm going to let Royce introduce himself, and then we're going to kind of talk through what he does and the benefits it can provide for those he works with. Royce, tell us a little bit about yourself.
Thanks, Angie. So, as you said, my name is Royce Porter, an occupational therapist for 10 years now. I'm from the Salt Lake Valley, but we lived out in Roosevelt in eastern Utah for 10 years and just recently have moved back. So, my ending time out in Roosevelt, I got to know an OB really well out there and started exploring women's health and worked with moms before delivery, during delivery, after delivery. I work with moms the day after birth in the hospital. But it felt like it was time to come home to the Salt Lake Valley. So we just recently moved back this last year and wanted to keep doing the work that we enjoyed so much. And so we still want to start our own kind of perinatal therapy clinic. So we have a clinic opening here, a location here soon in the next month or so. But currently I'm doing home visits right now.
Okay, very cool. All right. I love the home visits piece. We're going to come back to that. But as an occupational therapist, I think people are familiar with it, or it's becoming much more common that people are seeing a PT during a pelvic floor PT specifically during pregnancy. Tell us about the difference between that service and occupational therapy and kind of how does that intersect maybe with the cares that are already out there?
Yeah, so this physical therapy is a sister career of occupational therapy. We do have a lot of the same goals, but we kind of approach it differently. So I really focus on function, and function comes more from than just your physical recovery. A lot of it can do with sleep, nutrition, mental health, overall well-being. I mean, we approach it from every different angle. So, and especially at this time during preparing for birth and after birth, we want to make sure we do all of that. It's hard to encompass all that it comes into, but it's fun because in the end, it's whatever my client wants. One of the skills that we pride ourselves in occupational therapy is one, analyzing activities that are hard to be doing, and then we figure out why we can't do that. Is it because we don't have the range of motion or the strength, or is it because, we're tired all the time, we're not getting the sleep that we need, or we're just not getting our nutrition that we need, or am I just going that I could take time for myself? So we analyze what you want to do, we listen, and because every person's different, every person has different needs and wants, and I see myself as we are working together to come up with your plan. You're hiring me as a coach, as a therapist to help you. Not You're not hiring me to subscribe to my plan and my services. It's your plan, it's your services. I'm just helping you along the way.
So you can customize based on the needs of your client, you can customize the care and the service that is given.
Yeah, and it's
Very
just
cool.
a variety of, I mean, even social
Mm.
wellness. I've set goals and we worked on social wellness after having
So
kids.
this is a pretty like holistic, we're looking at all parts of the person surrounding the perinatal period, with
Yeah.
a focus on physical function as definitely goes into emotional function and social function as people prepare for and recover from childbirth, correct?
Yeah.
Okay,
Yeah. So
okay.
it's also kind of a little bit of I also call it behavior retraining. And
Yeah.
sometimes even when we're pregnant, we sometimes pick up maladaptive behavior, whether it be posture or just holding things in with our pelvic floor, just kind of squeezing everything. We need to relax. And so I have a firm belief with my approach that if we can fix and adjust behaviors, then a lot of times physical recovery can take care of itself as well.
Oh, very cool. All right, so tell me, and I know you have participated in a lot of this care yourself in your life. I want to, I guess my next question is I want to hear the difference between what you do and what a doula does. I know those are different categories, but how do those dovetail together? If someone's using a doula, how are your services totally different, or where do they intersect? Because you guys used doula when you had babies, right?
We did, yeah. For our second
Cool.
and third one, we had used a doula. So I don't want to speak all for what the scope of a practice of what doula can entail, for sure. There's going to be some overlap. It's one of the fun things of occupational therapy is that we get a little training in everything. So working with a doula, my goal is to support what training and what you are providing. Um, maybe with maybe with a little more medical training that I have, I can
Mm.
understand a little bit more of what's going on, the muscles, the nerves, the body, how it's reacting. But in the end, when I'm working with a doula, I want to be able to work alongside with a doula and provide further care and, bounce ideas off each other and work together and know like feedback from each other. Like, hey, like you know, our client is feeling overwhelmed. If there's something that you've been working on, or, this my mom, I have to have talked to her. She doesn't have any meals ready for after having her kid, or that's something we can work on together. And so I believe that collaboration has been great. I wouldn't have, I mean, with our second and third, without our doula, it wouldn't have been near the positive experience it would have been. After our first one, the joke is our Facebook picture that our family, a lot of people commented on our Facebook picture saying that why does Royce look more tired than you, Rachel?
He worked
Um,
hard.
it was 19 hours of counter pressures and holding her and doing all the stuff that we got trained from a holistic approach to delivery, which is my wife's approach. And it was exhausting. I mean, it was grateful. I loved it. I have never seen a greater demonstration of human strength than watching my wife give birth. So then with moving out to Roosevelt, where there weren't as much access to such services, we sought out more of what a doula was, and she helped us with our second and third. And as a support person, it made my experience so much better, so that I could appreciate the moment instead of being just full of stress and
Right.
trying to manage now a kid we had at home with, not with family, with neighbors, and
Yeah.
and then to enjoy what we were experiencing together.
Okay. So it sounds like, and the doula role is quite focused on that day, or sometimes it's 2 days or whatever, right? I've seen three and
Yeah,
four, but
right.
the actual event, right? So doulas, of course, prepare people physically, emotionally, mentally, bring their team together, support person. They do the birth. That's big. And then the doula kind of backs out, like they're still available for some postpartum support, depending on, limited phone calls and things like that. But the expertise then for that recovery piece, especially I liked you said your more medical background in the physical recovery, physical, emotional, and mental, that is more of your focus, correct? Whereas a doula, like we're like, hey, how you doing? How's breastfeeding going? We might kind of process the birth, but doulas, unless they're a postpartum doula, and even
Yeah,
that is limited to non-medical care, their follow through in postpartum is limited, right? Or shorter than maybe what you're looking at, right?
yeah, yeah.
Okay. So tell me, like, your ideal client, like when would somebody start services with you, someone with your role? So when somebody starts services with you, what does that look like? When is your heavy on when's your big focus on your services with clients? So to kind of walk us through what that might look like.
So I love working with moms who are pregnant. I love
Like
preparing their
early in
body.
pregnancy, are we talking like first trimester?
Yeah.
When do they come
When
into your
I,
services?
so with everyone being so different, I say when you start feeling like you're not being as functional as you want to be.
Okay, physically,
Um,
emotionally
yeah.
functional. Okay.
So I've had people come in, at 12 weeks, 20 weeks saying like, hey, I'm a dog groomer. I can't lift the dogs into the bath anymore. And so we talked about, okay, let's talk about how to lift dogs into bath, the physical part of it. Now let's talk about adaptive strategies. How can we stand so we can tilt our pelvis the right way? So I've had the 20 weeks. Generally, I see more at the third trimester time when we start to get a little bit bigger and start to take a little more strain on our bodies and our pelvis. And some get a little nervous when they start to feel or have a history of diastasis recti and they want to be a little more proactive about it. So at any point when someone is starting to feel like they're just not as functional and need a support person with medical training that they can go to and work with, I love preparing that. And those that have come and worked with me have done prenatal work. All of them have said that that delivery has gone smoother if they've had a history of previous. Not saying that it can't be 100% causation.
Right.
There's just, as you know, with in birth, you just can't prepare for every situation, but
Right.
we give it the best chance for it.
Okay.
And
So I hear some, this is awesome because, some of our clients have maybe physically demanding jobs that they need to work in up until delivery or
yeah,
thereabouts, right?
yeah,
So, I mean, if you're a school teacher or a nurse I had a dance teacher, several dance teachers actually lately, and they're
yeah,
teaching dance classes, right, through their pregnancy, or there's so many different roles that, like employment roles, right, or professional roles that our clients, that pregnant people are going to be filling. So what your services can do is help them do their job more comfortably throughout their pregnancy, like on a physical comfort level, and then you pull in other things as well.
yeah, exactly.
Cool.
So
So cool.
that's the basis of our therapy. I know we get a lot of people think when they hear occupational therapy, we think it's just jobs, but it's really just the things that occupy your time is what we focus on.
How you
So,
function in the day,
yep.
from
So
brushing your teeth to, yeah, okay.
to doing anything. Though, I mean, those are kind of the low level, which it's typically what occupational therapists are thought of. Help people get dressed, help people brush their teeth.
Yeah.
But I love working with people with higher aspirations and goals that really want to, I know I can do more. I want help supporting this. I want a professional problem solver to really
Yeah.
help me with this. And I've analyzed so many different activities. I've worked with dancers, I've worked with office jobs, I've worked with stay-at-home moms, I worked with anyone, pickleball players, the guys,
Okay.
anyone.
Okay. I love that because the a lot of the what we would call common, not normal, but common complaints of pregnancy and the physical, like sciatic, like my sciatic nerve. Some people are like I can't walk anymore. Symphysis pubis pain, like a lot of those common things that, as you dig into it, you can't. There are solutions to a lot of these things. So
Yeah.
care from OT. Okay, awesome, awesome. All right, so baby's born, everything shifts now to infant care, but there's like recovery. Recovery is legit, like recovery from any kind of birth, right? Smooth, short, simple, awesome to very long, difficult, arduous. Cesareans, VBACs, like every birth, regardless of how it goes, is going to have a serious recovery period, which needs to be
Right.
taken seriously, in my opinion. So tell me what that looks like in the postpartum recovery. Seems like that could be a very important piece in postpartum recovery.
It certainly is, and this is a point, like you said, I love the point of this is more than just physical. When I would work with moms the day after birth in the hospital, I would especially would hit up postpartum depression, anxiety, baby blues, and I would work with moms to make sure they have a plan. Some would say like, "Oh, I've heard of this. I don't know what it all entails, but I'm kind of scared for it." And so we talk about the plan that can be there. So that's one of the advantages I have with doing in-home visits is I can be there within, the first week and
Mhm.
just talking about how are you doing getting up out of bed, getting to the toilet, getting your things, you have support people ready for you. Let's show you a little safer way to do things. Let's talk about how you're feeling and about those postpartum and potentially start, and recommend referrals to mental health clinicians or to, let's give your medical or your birthing provider a call. Let's give them that talk. And I've had so many people have just been appreciative. I've had a lot of people just with tears come to their eyes when we talk about it. Even those I love working with those who have a history of maybe some anxiety or depression.
Mhm.
Because then I will try to empower them by saying, like, listen, like you've already dealt with this I mean, it's different, but you've already had you've learned some skills, you've learned some strategies that helped you. So you're far and you're more prepared than others who haven't even experienced anxiety or depression before.
Mhm.
So let's use those skills. So yeah, well, then we get into that, and then we kind of follow up on that. But then I just love, at 4 weeks or so, 3, 4 weeks, just start doing some basic stretches, just to start to open that body. We're not exercising really too much yet, um, so that way we can help the body recover faster. That's what I've had moms who worked with me in the past have said that we've I just enjoy the fact that like I remember the very first one I worked with was her third C-section, and she said, I've just I've recovered faster than any other C-section that I've had. I'm 30 years old, and I can't believe that this is this is so
Better.
much better. I wish I wasn't
Yeah.
anticipating that. So I love C-sections. I love helping, we get some tension in there. I love helping break up the scar tissue with that C-section scar, do some rolling on the skin to get some separation from the dermis and everything underneath if we're feeling constipated, and just teaching bowel management techniques. And, again, I try to, the best way for me to tell me what I do is just to tell stories of those that I've worked with because it's
Oh,
so hard to
absolutely.
encompass all of what I've done because I've just had so much fun. And that's what's fun about it is that everyone is so different. Everyone has different goals, and then just empowering them to get it back going.
Okay. So tell us a favorite story of yours, a client success story. What's one of your favorite situations that you've been able to provide services for?
And that's a tough one, but I'll tell you one
Maybe
that
top three.
one that pops to my mind right now. I've had a mom who heard about me on Facebook, and she reached out to me, and she's like, "I am 8 months postpartum. My OB says I have prolapse. Intercourse is painful for me. I pee my pants all the time. Um, C-section. I think she was a C-section as well. So she would come in because she loved me doing the C-section scar massage. She just loved the
Mhm.
feeling on that. She loved had it. She has diastasis recti, constant. I mean, she had about everything, I guess.
Wow.
Um, her insurance at that time only allowed 6 visits, so we really not rushed. We made sure to cover all the bases to get teach her
Mhm.
the skills that we could have, so she could go on her own afterwards. Um, but she left pain-free intercourse, was able to control her bladder, was able to
Nice.
just enjoy um life again. And I don't know, that was a really fun one. That everything really got me going at the
Yeah.
beginning.
You can see the impact that that
Oh
has.
yeah.
Very cool.
Yeah.
So this 8 months postpartum, right? I mean,
Yeah.
how far out postpartum can you help people? Like probably years, right?
Yeah. I mean, as long as I mean, again, you're not functional, you're peeing your pants, or
Right.
I love constipation, same thing.
Yeah, so many people, I'm getting close to, I'm in my high 40s at this point. So postpartum is long behind me, but I do have so many colleagues and friends around my similar age who say that again, common but not normal dysfunction, right? So bladder, bowel, yep, okay. So you can help not just your pregnant people, but
Correct.
anyone who has the effects of pregnancy, postpartum years even.
Yep. I just finished
Very
working with
cool.
she was in her mid 40s, and she knew that it was time to be discharged from therapy when she said that her husband made the comment that she's like, I know I haven't heard that you've peed your pants in a while. She's like,
Success.
she's like that was one of my goals. And so
Yeah, very
she had
cool.
that goal, and then she's like, I think we're done here. I'm like, that sounds great.
Okay. So you say, like, I heard you say 6 visits. I know every case is so different.
Yeah.
But walk us through, and it sounds like you can serve people at so many different points of life, which is awesome. But if you have a pregnant person, let's say you have a pregnant client, they're pregnant, they meet you maybe second trimester. What are visits, frequency of visits? Where do we time those visits before birth and then after birth? And how many are we looking at?
Yeah, so it's all it's hard to because it's so individualized. Some people feel like they need more support, right?
Yeah.
Like for example, we all know that we need to diet and exercise, but sometimes we need to go talk to a nutritionist and talk to a personal trainer just to kind of give that for us. And so some people need more of the support, so weekly visits beforehand are really supportive. Some are just like, I just need someone to really talk to, run through some things, and so I'm going to
So
come every other week.
they can drive their needs and kind of it's
Yeah.
different. Okay,
So
cool.
I see people who want to hire me as they're hiring me to help them. They're not hiring me from them to follow my plan. Like I am here for you. So
Customized to the needs.
yep. And I'm not going to pressure anyone because again, my whole goal, so my business is called Empowered Health and Wellness because I want my clients to feel empowered afterwards. Like I'm
Cool.
here. I mean, I can't call myself a coach, but I'm the therapist who's wants to have you gain those skills understanding so that when we have future problems or issues, we know what to do because we were trained how to do that. So yeah, before birth, it depends on what person that one person who came in at 20 weeks, she came then, and then she came once a month, and until the very end, then she came a couple of times. Another one who was a ran cross country at Utah State, she came every week from her third trimester on because she was really she had a history of the diastasis recti and then had the umbilical hernia.
Hmm.
Um, but then say we don't do any of that and then we start seeing people afterwards. I like to check in if we can as early as we can just because I want that early check-in. I've had people comment how they enjoy just having someone to talk to because they don't. Yes, they have the OB will say if you have any issues, give me a call. But how many are actually going to give a call?
And when you
You know?
do call, you don't talk to your OB, right?
Yeah.
Like, yeah.
So I've been there for that. And then, we start at 4 weeks. And then usually, if it's everything kind of standard and things are going well, usually 4 to 6 visits afterwards. But I've had people who did extensive work maybe beforehand, and we only had just a couple visits afterwards. And then again, it all depends on aspirations and goals. So I've had some people, we get to that fourth or fifth visit, and they're like, you know what? I'm not peeing my pants. I feel like I've gained the skills that I need. I've exercised a lot before. I think I feel good about going on from here. Like,
Okay.
sounds great. Like, we can be done. I'm not gonna pressure you to
Yeah.
do any more. And then others will say, like, you know what? I used to run a lot. I used to do a lot of, I just have high expectations for myself. So I want to keep coming because I want to keep asking questions and following up and knowing
Getting
what I
back
can
to where
do.
they want to be. And
Yeah, so
yeah.
everyone has different levels of aspirations and expectations, and again, I let them drive it
Yeah.
how they want it.
Very cool. I love that. All right. So what this is like, I don't know. This is awesome. I think what a cool service that can affect the whole lifespan, right? This is a over a long, this isn't just a one visit type of thing generally, but it sounds
Right.
like over a longer period of time we can make a huge impact. So, all right, Royce, like tell me what it's like being a man in this space. Like this is, women's health care, maternal care. Many of our providers, there's plenty of male OBs, like that's common, but tell me what it's like being a man in this space. I know you've been through this personally yourself, like with the children you and your wife have had, but tell me what that's like.
It's different. It comes with some roadblocks. It's just a natural thing being a man working in women's care. Sometimes I get people ask me why I do it in the first place, and I have such the utmost respect for anyone who's willing to, let's say, sacrifice their bodies or have their bodies go through a traumatic experience to bring life into the world. Like again, I love watching sports. I love watching anything, but the greatest demonstration of human strength I've ever seen is my wife giving birth. And someone who's willing to go through that, I have so much respect for. And so to be able to help a population that may feel like they're being overlooked or forgotten about, we've heard many people talk about how I give birth and then all of a sudden everything's about my baby now. Nothing's about me anymore.
Right.
Um, I don't feel like that's the case. And so I've seen such turnaround, such joy come back into people's lives because of this, where at one point they felt like, for one lady, I'm a school teacher and I'm peeing my pants all the time. Like I have to have a spare clothes in my backpack when I go to school because I can't manage this. And
Hmm.
finding those tweaks, those to the day. And, for her, we set her a bathroom schedule that she could follow while she was teaching. And then
Cool.
she comes back the next week saying, I'm not peeing my pants anymore because now I know how to hold in my urine, how to void all my urine, how to, when to go. And so just those, sometimes that's what it is. I've had some people come in for just a couple visits because I'm like, okay, like here is the behavior we're not doing well, and here's how we fix that. And I've had people come back saying, that was it. Like
Hmm.
I
Hmm.
had a mom come in with she thought it was some carpal tunnel, but it was really some ulnar nerve pain. And
Hmm.
after talking with her and having her show me, because since I'm a functional therapist, what she's been doing at home, I found out that she was lifting her car seat into her car wrong.
Hmm.
And so I was able to show her some stretches to help with those muscles, with the nerves, some ulnar nerve glides and some other stretches. And then I'm like, let's practice how to put in your car seat correctly. And so we showed her a different way to grip it, how to hold it, the body mechanics. And then she comes back a couple weeks later for a follow-up and she's like, the pain's gone. That was
Hmm.
it. So
Cool.
sometimes it's just, I don't know. I hope that's now I'm going on tangents, but I hope that answers the question about being a male
Absolutely.
in here.
Okay. Yeah, yeah, that's cool. And I think there definitely is definitely a place for that, which I think, thank you for doing this work. That's amazing. And then you
Yeah.
brought up for me too, like, what an, and I think a lot of people want an approach that's not surgery or medication first, right? Like, let's see
Right.
what we can approach ahead of that to avoid those bigger procedural or pharmaceutical fixes. So, a lot of what you can do just with adjustments in life can help with that. Very cool.
Correct. Yep.
Okay, awesome. Um, Another question, like pelvic floor PT. A lot of people are getting services from pelvic floor PT now. How's this different? Like, walk through how, are we totally two different animals here? Like,
Yeah.
tell me what that looks like.
So that's where I got my start was studying pelvic floor. So this is a lot of what we do as well. But and the approach that I have that I got from my clinic out in Roosevelt was I don't do any internal work. Um, for some that have really felt like that's what they need, I've been able to pass them on to other pelvic floor therapists who do internal work. But again, my business is empowered health and wellness because I want to be able to empower those to be able to manage their own. And so I've been able to
On their
coach.
own, yeah.
Yeah, so I'm able to, I mean, granted, at some points, some cases, there needs to be some internal work to do some diagnosing. And but I've been able to coach moms to use pelvic wands to kind of relieve their tension and kind of feel what's on there. I have most of my clients do, if they want to as well, we bring it up. Um, a self-examination. I have a kind of a four option method for those that can go home and do their own examination. They come back and tell me what that feels like.
Again,
Um,
empowered, right? You're
yeah,
empowering them in their own
exactly.
health. Yeah, cool.
So dilators, again, I have coupon codes and whatnot for different dilators and
Yeah,
equipment that you can get. And there's great YouTube videos out there, and I'm a resource to ask. And if I don't know, I have plenty of mentors I have across this who have supported me that I love when we reach out and talk to each other. So because again, say we work on this, right? And we feel a lot better, but then a couple years down the road, we may forget some of our habits, we slip into previous habits.
yeah,
And then we're like, okay, like I remember the steps. I have my pelvic wand still. Like I can go and work on these things. So I don't need to go back and do pelvic floor therapy because I know how to do it myself.
right.
So,
Cool. Okay, awesome.
so yeah, that's my approach.
Okay. And then home visits. Tell me about home visit. I think, and as I work as a postpartum doula and lactation consultant, and I do home visits, in those two categories. But I see people so often they get home from the hospital, they got to get out the door the next day at a certain time, get to a pediatrician appointment, or maybe there's a chiropractic appointment they're going to, or hopefully they don't have to go back to the hospital or their provider yet, but sometimes there's a lot we impose a lot of appointments on immediate postpartum people
Yeah.
that are challenging to meet. So the fact that you offer home visits in the comfort of their home with those around them, right? Like it's hard to haul everyone off to the doctor's office or whatever clinic visit we're doing. So they can have their support person there. They can have, the babies there. You're seeing how they're moving in their own space, right?
Yeah.
How are they getting on? What is their bed? Are they hiking up a ladder to their bed? And I honestly have had clients on bunk beds. One
Uh,
particular client, her bed, it was a queen, and she would hike up to her bunk bed, and I'm like, wow, okay,
yeah.
that's a neat place to do postpartum. So when you see them, I imagine when you see them, first of all, the benefit of not having to go anywhere with a newborn. And we say now stay home, take good care of yourself, and then come to these appointments. And in our culture and society, I'm going to get off on a tangent if I'm not careful. We want people to get right back to it, right? Like you're at
Yeah.
soccer on Saturday, so you're at work 3 weeks later in some cases, like get right back at it. There's demands of life that our postpartum recovery is so short, way too short. So talk to me about home visits. Like that is so enticing, I think, and what a great service. But tell me about that a little bit.
Yeah. So I love going to people's homes because I love seeing clients in their natural context. That's the fun of it. So, being that functional therapist in a clinic setting, which is great too. Some people just love the feeling of the clinic setting, but we simulate what home may be like, right? We say like, hey, here's
Right.
the skills, we're practicing them, right? Here's how you sit on a toilet. Like, now go home and tell me what that feels like. Where at home we can see what the
Your
bathroom
toilet.
set
Yeah.
exactly, right? We can see what your bathroom setup is like, how we get on off our toilet, how we get in and out of our bed, how we manage our kitchen, how we
Even
do all these different
stairs.
things.
A lot of people are
Yep.
living upstairs, downstairs, right? Like,
Yeah, couches, beds,
yeah,
kind of all that context of the environment, plus the comfort of not having to pack up and go,
yeah,
right? And just feeling that. And so I mean, part of my training out in Roosevelt in rural Utah, I did home health for most of my time out there.
cool.
So, and I've done pediatric therapy as well. I've done I've done everything. So even if there's questions about development or like how my kids functioning or how my kids developing, those are
Yeah,
again, I'm not for me. So one thing I haven't talked about. So I'm as a cash-based business. I'm not taking insurances. I'm not tied down to what an insurance company is telling me to do or tied
right,
down to what a doctor is telling me to do. So in a typical hospital setting, if I seek insurance reimbursement, I have to stick to what the diagnosis says and what the insurance says is allowable.
right.
In this setting, I'm able to, I've,
Full services. No,
yep,
no, nothing's inhibiting your services.
yeah. So I can practice
Cool.
the top of my license. So we can,
Yep.
again, talk about early intervention and just kind of the developmental stages. My kid doing what, reflex
So
testing.
you can pull some
So
baby stuff into this. Like,
I can as well. I haven't,
oh, so
it's not
cool.
an area that I've marketed as much as well, but
Yeah,
it's been, I mean, it's trainings that I have. I have the resources. It's not my, again, primary focus, but I've had to do that in Roosevelt because there wasn't an occupational therapist to work with
right.
young kids, and so they would come in and see me, and I pull out my books and training and sit
Yeah,
down and let's figure this out together and let's go through
cool.
this and let's soundboard and so yeah, I'm willing to do and able to do just
Yeah.
about anything.
And I can also see where this will be beneficial for breastfeeding moms. As a lactation consultant, I get people often, and I am not, I mean, I'm a trained lactation consultant, of course, but, and I try to get good support of the wrist and the hand. And so many people with breastfeeding, you spend a good deal of time holding something that's 7 or 8 pounds right in front of your body, right? So
Right.
people have like, oh, my back, I didn't know I had that muscle and I'm aching here and there. Same thing, dads sometimes, like just from holding that baby or rocking that baby, getting that baby back to sleep, are having some, physical discomfort that they're talking about. So I imagine the work you do as well will enhance the breastfeeding experience on a physical comfort level, right? And functional
Yeah.
level. Okay.
Yeah. The client I'm working with right now, one of them, she said that, when the first visits or second visits, once she got the idea of what an occupational therapist is like, she brought up back pain during nursing. So we brought up
Aha.
a couple of different tactics to help with that. Um, and again, we come back the next visit and she's all like, yeah, they're not hurting anymore now that I kind of know what to do afterwards.
Yeah.
So it's again, sometimes just those tips, but we learned that then. And then she brought it the next week. Here's another functional question I have. What do I do with this situation? Like, oh, I love these questions. Let's talk about it. Let's figure this out.
Yeah.
And I come back the next week. She's like, yeah, that's not a problem anymore. Now let's talk about this one.
Yeah.
So
Let's move on to, yeah, get better and better all the time.
I love it.
So cool. Oh, what a great service. Okay. This, as I've been doing this work for over 20 years, and I love to see, as we're expanding services, that things become normal, right? Like as we do look at the whole picture, the whole lifespan of the woman having a baby. I love that you can provide services for people years postpartum. I can
Yeah.
see a huge benefit to people who are in their 40s and 50s and having, common but unusual, physical effects from sexual dysfunction to incontinence, bowel or bladder. That's awesome as well. And of course, I guess my passion is the perinatal period as well. So
Yeah.
I love to learn about additional services just to improve this time of life for people. Royce, how can people reach you? Are you comfortable sharing like how people might be able to reach out to you?
Yeah. So, I guess empoweredclinic.com is my website. Um, I have a contact form on there. I do free consultations. So there's a form on there you can fill out. You can call or text me, 801-215-9789, and we can set up a time that way to do a consultation. On Facebook, I'm Empowered Health and Wellness. So it's it's around and or
Okay, they can
yeah,
find you. Okay.
I
And
can. Yeah.
then do you do any virtual work if folks live outside of your service area, if they're far away? And we do have, a national, international audience too for this podcast. So, If like, do you do any virtual work? Is that something that's what can you provide virtually, if anything?
Yep. So I can provide the virtually as long right now as it's within our state.
Okay, so in
Um,
the state of Utah.
yep. So we
Okay,
have but for those who are nationally, you still reach out.
okay,
I can find you places, especially occupational therapists within your
yeah,
area.
good
Um,
referrals.
but we do have an interstate compact coming out, hopefully rolling out this summer, where I can serve. I think last I count was there's 31 states in this compact, which allows me to serve others. So just within the licensure laws, I have to stay
Yeah,
right now within my state. But for those listening now or at later times, reach out because again, I have networks of occupational therapists around the nation that
yeah.
I've already found some in Florida for other people. So
Cool.
it's
Okay. And
yep,
good to know that this service from occupational therapists is available.
yep,
I don't think, as I've worked with thousands of families, I don't think people say, "Oh, my OT." So I love that that's
yeah.
becoming available for people. That is incredible because I love the full span it looks at to help service and improve lives. So
I
cool.
love it too. I've had so much fun with it.
I love, and I can feel, as we've spoken before as well, I love the passion you have for this work. And thank you for doing this work. It's important work, this period of life and for women's healthcare. Any
Yeah.
parting thoughts, Royce? Any last things you want to leave as we wrap things up?
I just wow, I want to express gratitude for this. Like it's just I love talking about why I love what I do. So I love that fact. But I do want to end with a quote. This is the quote that I think got me into women's health in the sense of once I read this to our obstetrician in Roosevelt, he was fully on board with it. So this is a quote from the American College of Obstetrics and Gynecology. This is their recommendation.
Good old ACOG. Yep.
Yep. So it says to opt, it's a little bit long, but I try to shorten it, but it real encompasses. Anyways,
Oh, let's hear it. Yeah.
to optimize the health of women and infants, postpartum care should be an ongoing process rather than a single encounter, with services and support tailored to each woman's individual needs. It is recommended that all women have contact with their obstetrician, gynecologist, or other obstetric care providers within the first 3 weeks postpartum. That summer sometimes doesn't happen.
Right. Hardly ever, I would
Yep.
think.
So here it and it continues to say that the initial assessment should be followed up with ongoing care as needed, concluding with a comprehensive postpartum visit no later than 12 weeks after birth. Again, that more often than not does not happen.
The
I mean,
comprehensive part. Yeah, I don't know.
yeah,
Yeah. Yeah.
even my obstetrician that I was with, he said he had about 50% of his moms come back for the 6 week follow-up.
Really?
Yeah,
Wow.
and
Wow.
and then as I've gotten into more research, that number supports national numbers as well.
Interesting. Hmm.
And so we have some moms that say like, I'm feeling fine. I don't feel like I need to go back in.
Yeah.
So
Interesting.
to finish the quote, it says the comprehensive postpartum visit should include a full assessment of physical, social, and psychological well-being, including the following domains. So here's all the domains that should be in that 12-week visit: mood and emotional well-being, infant care and feeding, sexuality, contraception and birth spacing, sleep and fatigue, physical recovery from birth, chronic disease management, and health maintenance.
Hmm.
So I asked him like, I goes, how's that postpartum with comprehensive visit that your ACOG is recommending? And he's like, well, if they come, and he gave me kind of the runaround, but I said I can help and address every single
All
one of
of
those
that. Yeah.
besides contraception and birth spacing.
Right.
But I can address every single one of those, and I'm not afraid to address them. It's not just the physical recovery. Like they say health maintenance, those, with other comorbidities,
Yeah.
diabetes, or some heart failures or something. We can incorporate, because of the medical training, all that into there. So I've addressed every single one of those domains. And so when I told him, like, instead of people, filling up your schedules and your list, like send them on to me, and we can free up your schedule, and we can get the as comprehensive.
Better care,
Um,
really, like, right?
yeah.
Because you can look at the whole picture, whereas those 6 week visits sounds like only half people get to that, which is interesting. It's a quick touch point, right? They're like 10 minutes, 15 minutes maybe. And I would say they do not touch on nearly all, there's very few of those things they touch on. So that is your
Yeah.
role. And you're going to see them, sounds like far before that, be in contact before and after, and the continuity of care that you provide.
Yep. So,
Hmm,
yep.
cool.
That's why I love that quote.
That is awesome. And it's kind of dismal where we're at, right? Like
Yep.
there's a lot of work to do and you're doing that work, which is amazing. So,
Yep, and I like that too. That I coached a lot of moms to be proactive about their health care. I'd have some that would come and complain that, yeah, my OB never addressed any of this. I'm like, well, did you bring it up? And
yeah.
they're like, well, no, I was waiting for him to. I'm like, well,
Yeah.
let's practice, so we work on self-advocacy skills. Like, let's
Which
prepare. Let's
is
have
a
a
great
list.
life skill, right? With your child's
Yeah,
pediatrician or a teacher or an employer, like
yeah.
that's a great life skill you can
Yeah.
take into anything.
So when I studied with pediatrics, advocacy, self-advocacy is not a developmental skill. It's a
Mm,
learned skill.
mm,
And so I would set self-advocacy goals for kids in the school district when I was
yeah.
there. So yeah, so let's talk about how to and having lists. Anyways, I could keep going
Oh,
on,
oh,
but
I love
that's
it.
let's be proactive about it. Let's ask our birth providers these questions and be ready to talk about them instead of just saying like, oh, they didn't bring it up, so I didn't bring it up. Well,
I didn't know it was, yeah.
so I've helped
Cool.
people prepare for that postpartum visit as well by
Yeah.
saying,
What
let's talk
what
about,
questions to take? What,
yeah,
yep. I love that. Cool. Well,
okay.
Royce, I wish I was still having babies. This sounds like a great, I know a lot of people that are, but
Yeah.
I appreciate the service that you provide here in Utah. And yeah, hopefully people, as people learn about this, I hope they can take advantage of that because it sounds like it's going to benefit their lives, have a huge impact on not just that postpartum recovery, but all of life. So very cool.
Well, I appreciate the time. It's been a lot of fun.
Well, thanks so much for being here with us. Again, this is Angie Rozier closing up this podcast episode with Royce Porter, who's an occupational therapist serving the people of Utah. I hope you can go out today and make some good human connections, like contact someone, a virtually eye contact. If you can get physical contact, make a good connection, human connection today, and help improve the life of someone around you. Thanks for being with us, and we'll see you next time.
Thank you for listening to the Ordinary Doula podcast with Angie Rozier, hosted by Birth Learning. Episode credits will be in the show notes. Tune in next time as we continue to explore the many aspects of giving birth.